because I know you want to get to the
Sure.
point. But I
Good
think it's
evening,
fun for
everybody.
people to know who's on and to get
Good
to know.
evening. We're glad you're here, and thank you for taking the time to learn more about our Health and Wellbeing Committee for Horses. My name's Laura Newman. I'm the board president of E3A, as well as a master trainer in training for the organization. So thrilled to be here and looking forward to what Dr. Jesse has to share with us.
Great. And we'll introduce Dr. Jesse in a minute. Um, Nicole, could you say who you are, my dear?
Sure. Nicole Shannon. I do office management for E3A, also E3A certified practitioner. And yeah, I'm basically the person you come to if you have any issues, complaints, want to get some register for something, want a recording of something. That's me.
That's great. We're lucky to have you. And Karen, could we hear just a brief intro of yourself?
I'm in Texas and it's hot here, and I just did a lesson, so you're glad this is Zoom and not in person. Uh,
Would we be doing this?
yes, you would. But I own our Live House Riding Stables. I am an E3A practitioner, and I contract with a community health corps here in the local area to provide equine assisted learning for kids ages 3 to 18. So that's me in a nutshell.
Wow. Wow. Good elevator speech, Karen. So I may hit you up later because we're trying to get some more demos. And if you're actively doing a program, we would love to. So you may be hearing from me. Haha.
Oh, okay.
Great. And Patty, tell us.
Hi, everyone. Patty Seymour. I live in just outside Raleigh, North Carolina.
Oh,
And I have come to you guys just when I had pneumonia and I was kind of forced to be still and watch some videos and learned about you through this. So I'm excited to be here. I'm planning for this to be my second career in corporate. And I'm so
ooh.
excited, and I'm starting, the foundations course and certification.
Oh, Patty, that's
Yeah,
fantastic.
yeah. So, and I do want to talk to you, Boo, about membership, growing the membership in this area of,
Ah,
I'd love to like just get people at my barn interested or others so I can have a partner to help facilitate workshops in this area. So I'm
well,
very
my
excited
son
about it.
lives and works in Raleigh, so you better beware because I
Oh,
might have to come visit you.
yes, please do. Yes, we'll have lunch, Boo. We talk you.
Super, super, super. Great. And let's see. Emma, are you on, sweet one? Emma's from Australia, so she was blocked. Let's see if we have Emma, can
Hello,
you come
can
on?
you hear me? Hello, I'm
Yes,
just
we
in my
can.
car. So, hello. Hang on 2 seconds because I have just pulled into my driveway and I'm going to see if I can get
Yay!
myself.
There's the
Hello.
happy face.
In all my crazy mum morning, I've just dropped my kids off at school because it's early over here in Australia. I live just outside Melbourne.
And it's
And
winter, right? Winter
it's
started.
winter, so I'm all dressed up. I've been out feeding horses in mud and slush and frost this morning, which is hard to probably believe where you are on the other side of the world. Um, so I'm a certified practitioner. I was over in Texas and did my certification in 2022. My business is EQ Leaders. We work in the corporate track, so we work with executive leaders, senior leaders across organizational development with our beautiful team of horses over here.
Great. And I wear your slippers and I cozy up with your beautiful cover and your coffee cup. So it's
Yes,
so fun
well,
to have you here.
I was also, so I was fortunate enough to be a speaker at the Horses and Healing Symposium, and I got to meet a lot of you in person, which was fantastic, having, been connected on LinkedIn and what have you. So it's great to see some of you again.
Well, great. Thanks for joining us. Scott, tell us about you. You're our token man and we're delighted. Hello, Scott. We'll come back to you. How about Janice? We'll come back to Scott and Lee. Hi, Janice.
Hi, everybody. I'm off camera tonight because I have been awake since 2:30 in the morning, so I'm feeling a little muddled and don't want to scare anybody. But my practice is called Equanimity, and I was certified in E3A 12 years ago, which seems like forever, but it's gone by really fast. My focus is in corporate work and teamwork, leadership work as well. And I'm based in New Hampshire, about just under 2 hours from Boo.
Great. We got to talk, Janice. We got to talk more.
I'll look forward to it.
Great. Scott or Leah, can you say hi? And if not, we'll mush on.
Yeah, I'm Scott Nicholas. My wife came in about an hour ago and said, "Would you jump on this meeting and take notes for me?" So,
Oh,
so I'll just be the note taker. But yeah, we live here in Magnolia, Texas. So
another Texas folks.
mhm.
Well, that's great. Say hi to your wife for us. We're
Will do.
delighted to have you. So please feel free also to chime in. We would love to have more men doing this work. And Leah, are you there?
I am.
Great. Tell us about you briefly.
So I'm the founder and executive director of Stepping Stone Farm School of Horsemanship,
Oh, how
which is
funny.
I've been this for 22 years. So E3A certified since I think 21.
Where are
And
you located?
I'm in just south of Milwaukee in Wisconsin.
Wow.
And we are a rescue and sanctuary and do a fair amount of programming as well.
That's great. I don't know if you know, but that's the same name as my farm, Stepping Stones Farm.
I do know that.
Oh, okay. Okay. Nice to meet you, Leah. But last, but it's certainly by no means least, let's introduce Jessie. She is our veterinarian and head of the E3A Equine Wellness, and she is a busy lady. So we appreciate you speaking with us tonight. And I don't know if you want to further introduce yourself, but we're just thrilled to have you here with all these big letters after your name. So thank you.
No, thank you. So, Dr. Jessie Newberry, from Missouri. I was in private practice doing a lot of warm blood work, but I grew up showing horses, rodeoing, still have horses today, trail riding. Today, I work more with cattle and swine throughout the U.S., but I'm super excited to be involved with E3A, learn more about it. Obviously, I'm not a practitioner, so I'm learning and hopefully can bring a veterinary side and some welfare to the organization and answer lots of questions for you. So I'm pretty open. If you have a question, just speak out. We're probably not going to stay on time tonight. I will warn you. We had a nice little topic picked out, and then New World Screwworm entered the U.S. on June 6th. Which is super important for y'all in Texas. So we will cover that at the end. So if no one has any questions for me, we'll kind of jump in.
Let's do it.
And hopefully we jump in. There we go. Okay, so first of all, disclaimer. This information is presented as general information. I am not your veterinarian. You cannot take anything that I say, and I am not licensed in any of your states except Kansas and Missouri. So informative. When you have more detailed questions, please seek your veterinarian in your state. So a lot of you all work with geriatric horses. So we wanted to just talk about, okay, what are some care of geriatric horses? Because as these horses age, as you all well know, their requirements are different and they start to have different diseases that present, etc. So when is my horse really considered geriatric? Today, horses are living between 25 and 40 years because they're doing less work and they have better care. Kind of like humans, we're living longer, as are our horses living longer. So we used to call an 18 to 20-year-old a horse a senior. Now a horse is considered senior when they hit 15 to 18. And none of us in the industry have really settled on an age when a horse becomes geriatric. So we say, okay, around 20 years, but it really varies depending on the horse's health. So these are actually two of my horses. The one on the left is Sunshine. She's 23. She retired about 2 years ago. We had some kids out that rode her last Sunday. She's really healthy. I don't do anything different for her care than I have the last 20 years. However, Loopy, who you see on the right, is also 23. He has Cushing's. So you can see I started to clip him and then realized I needed to take a picture, kind of before and after. And he has a lot of issues. So he has arthritis. He needs bute before the farrier comes. He doesn't tolerate heat well. So he has a lot of these geriatric problems we're going to talk about tonight. So just an example to show you, each horse is different and we need to evaluate them on an individual basis and tailor their care. So some of those common diseases that a geriatric horse have, lots of dental problems, loss of teeth, lameness, arthritis and multiple joints. They don't absorb nutrients as well. So they can still be eating the same thing, but not absorbing those nutrients. They struggle to digest the protein as well as they did when they were younger. You have pars intermedia, PPID, they have Cushing's. They don't tolerate environmental changes as well. And you and I may think that is just, okay, it's really hot today, 30 degrees warmer than yesterday. But it's also pasture mates, so they can get picked on more. You'll often see, your boss mare kind of move down in the herd as they age. And then decreased immune system functions, whether this is recovery, vaccinations, they need to be vaccinated more frequently than, I would say, a mature working horse of 12. And then eye problems, they do develop cataracts. So lots of things. We don't have time to cover them all this evening. But just wanted to throw this out there that these are some really common things that you may want more information on later. Excuse me. Okay. So what are we going to talk about today? We'll talk about the yearly veterinarian exam, recommended vaccines and preventions, oral health, nutrition, kind of at a very high level, body condition scoring. So if you're not, doing that currently, it's complicated, but we'll introduce you to it. Then some general care, and we'll kind of wrap up with quality of life assessment. How do we tell when it's time to humanely euthanize a horse? In a little bit of a scientific way that helps you really make those decisions. So for all of our horses that we use in our work, we do recommend that you have a yearly veterinarian exam. This becomes a little more in-depth for your geriatric horse. So a complete physical exam, a dental exam, and we'll talk in a little bit. It's more than just checking for points in your geriatric horse. Body condition scoring, a Coggins test, and then blood work is needed. As of today, we think that if you're using your horse for work, you also should ask your veterinarian to determine if the animal is fit for work. So older horses may have muscle atrophy, not be filled out as much. So it's nicer just to have a veterinarian say, yes, I believe, you're not riding this horse. They're in the arena. They're walking around. Yes, this horse is sound for that. They may not be sound to ride, but they may be, sound and fit for work. A little bit of a lameness evaluation. I'm not talking flexions and a full lameness exam, but, walk that veterinarian walk the vet around too, but walk the horse around, let them evaluate, how well they turn, talk to your veterinarian about how well your horse gets up and down, etc. And then also safety evaluation based on type of work. Some animals, have a cataract, decreased vision makes them unsafe. Other animals that maybe they lost an eye and have been without the eye for 10 years may be fine. But again, just get your vet's help in evaluating some of those things. One thing that I really like, your veterinarian should give you a report from the exam, but as these animals age, let's really keep it in a organized fashion that you can compare from year to year. So Merck Animal Health has this senior horse special needs. They call it a library. Your vet can fill this out year after year, current health, what is their body condition score? Just so we remember to really check all of these things, but also have it in a place where we can compare it easily. And you're not going, last year I think they were a body condition score 5, but I don't really remember. So while your vet's there, let's go ahead and have them administer some vaccinations and other preventions. So the American Association of Equine Practitioners, that's all the equine vets, that's our group. You'll hear me refer to them frequently, recommends these yearly core vaccinations. That means every horse needs these vaccinations every year. Rabies, West Nile, which becomes more important again as horses age, Eastern and Western equine encephalitis, and tetanus. So those are the ones, no matter where the horse is, these are the core vaccines they need every year. And then depending on where you're located, your horse may need influenza, equine herpes virus, had an outbreak last fall. We came to you and provided information about that. If you have horses coming in and out a lot, probably a good one. Potomac horse fever is a regional botulism, and leptospirosis. So those are some other things your vet may say, hey, I think this horse could benefit from this vaccine as well. And then other basic animal health care. So a Coggins every year, testing for equine infectious anemia, and then deworming based on a fecal. When I first got out of practice or got out of vet school and I was practicing, we had a regular quarterly rotation for our dewormers. Today, we know that's not the best way to approach that. We were creating a lot of resistance. So have that fecal. It's cheap. And it allows you to see what worms are on the farm and what dewormer you need, or maybe not. A lot of times we find that animals are dewormed more frequently than is needed. And horses don't tolerate, or geriatric horses don't tolerate worms as well. So super important in the geriatric horse. Right, let's talk about the mouth and oral health. So as I'm sure all of you know, horses are hypsodonts, so their teeth continue to grow. Especially the first 5 years. So they lose all their baby teeth, get their adult teeth in, and then that tooth continues to grow, but they eventually run out of enamel to grow. And so in this picture, you can see next to the dime how tall and how much tooth is there for a 7-year-old horse. And then when you get to that 30-year-old horse, there's hardly anything there. That also means the roots are absorbing, so they're more likely to lose teeth. So even if they have teeth, if there's uneven wear, if there's a wave in their mouth, if they're parrot mouthed, this as well can cause problems as horses age. So to evaluate that, we need to do a yearly sedated oral exam. So here you can see the horse is sedated. We're holding his head up with a halter, really getting in there, examining every tooth, looking for decay, fractures. Are they missing? Do they need to be pulled? And in this photo, we're also taking photos to evaluate that and keep a really good record from year to year. Then your vet will also evaluate the gums and the tongue. If a horse ever has a laceration on their tongue, a cut, that can affect how they can move food around in their mouth. Some things to think about that affects the tooth wear over time is what the horse eats. Are they on pasture versus a high grain diet? Individuals, they're all different.
So can I ask, is pasture versus high grain diet better or worse?
It's just different in terms of what they're chewing, how long they're chewing. So most horses, left to their own devices, will graze about 60% of the time out of a day. So they're chewing more, but what they're chewing is not as aggressive. They're not trying to break down corn or an oat or something like that. So one is not better than the other. It's just different. But love the question, Boo. Thank you. Also dental care over time. So routine dental care as the horse ages really prevents us from opening a horse's mouth when they reach that age of 20, 23. And we find they need a lot of corrective work, and there's not a lot of growth left of that tooth to correct. At the same time, over-aggressive dental care literally shaves off years of chewing surface. So selecting the right veterinary dental practitioner is super important to have the work done.
I'm asking a second question in a row. Is it better to have it floated or with the new mechanical drills?
So the mechanical tools and the hand floats actually perform the same function. So we're grinding down the tools. It is a matter of ease. So with a power float, I can float a barn of 20 horses a day and I'm still physically able to do it, and I'm fast. And I don't need to boost my sedation. I can also float horses just as well using hand floats. I physically get tired. It takes longer, but also by moving that float in and out, I'm more likely to cause, just damage to the horse's mouth because I accidentally get the rasp off to the side, or I hit the back of their mandible as it goes up. So again, one is not better than the other. It is the angle that you use, how much tooth you take off, how you make your corrections. So if you're after this oral exam, your veterinarian finds missing a worn teeth, they may say, all right, we need to make some changes. So instead of just regular regular hay, say maybe used mixed grass hay, we may need to change to a short stemmed forage. So put them out on grass that they don't have to chew as long or as tough of a stem. Maybe we change to chopped hay or alfalfa instead of having long stems. They may also say to feed your horse soaked alfalfa pellets. If you feed a horse an alfalfa pellet that is not soaked and softened, they will choke. It's too hard for an older horse to chew up to the appropriate about quarter inch to half inch size. May suggest you supplement with a mash, either beet pulp or rice bran. One thing that I think is super important, and I wish I would have known this earlier in my career, start feeding mashes when the horses are younger, even if it's just once or twice a week as a treat, because that's really different. To ask a horse to, go from eating hay or a grain that they really like to eating something mushy, it's a different consistency. The taste is different. Get them used to that earlier in life so that if it needs to become a major source of their diet, they're more willing to consume it in a short period of time, because we can all imagine the amount of mold and bacteria that can grow from having to soak their feed more than just a few hours. Your vet may also say that your horse can benefit from a complete senior feed. These senior feeds are designed to meet all of the nutritional requirements of your horse, but they have to eat a lot of it. So that may be a financial consideration as well, but your vet will talk through all of these options with you. And honestly, it's going to be a bit of trial and error. And what works for, in my situation, loopy is not going to work for sunshine. You've got to find what fits that individual horse's needs and preferences. Side note, because we have horses that have Cushing's or are sensitive to laminitis, beet pulp is lower in sugar than grass hay. And if your horse does have Cushing's, you do need to be considerate about limiting starch. So something to think about. You can't, probably aren't going to jump to a complete senior feed because it's going to be higher in starch. But working with your veterinarian or an equine nutritionist, Purina, for example, has really good equine nutritionists on staff. You can, get multiple professional opinions on that. So if the horse is having a problem with oral health, what is it going to cause? Weight loss is obvious, but also muscle atrophy. So I'm not sure if you can kind of tell within this picture, but this horse here it's pretty flat over the rump. Here at the hip is sunken in. The withers, there's a lot of muscle loss here. If you're still riding an older horse, you do need to check the fit of your saddle. They may still be sound, but as they age and have muscle atrophy, just like people do as we age, check the fit of that saddle. Oral problems can also lead to choke, where a horse, may have food coming out their nose, obviously choking. That's a veterinary emergency, but it can happen because they're not getting their food really chewed up well, or even colic. So some things to kind of watch for. Questions about oral health before we move on to nutrition?
I have
Yeah.
Can you hear me?
Yes, ma'am.
Okay, I'm sorry. I thought I was muted. I apologize for all the coughing. I have asthma. So anyway, I have a question. I have an older horse, and people have told me, not the veterinarian, to give it like oil, vegetable oil or corn oil, or is that truly something? Or I haven't done it, but I
Yeah,
wanted to know if it was truly something or not.
it can be truly something, but you need to talk with your vet about it. You know, I'm sure they'll do a quick phone call, because you have to take all of their other health needs into account, right?
Okay.
So just ask. It can be very beneficial. I have recommended that in the past. But one thing is not going to solve the issues. So have that full conversation with them.
Okay.
But love the question.
Mhm.
All right. So I let the cat out of the bag earlier that horses naturally spend 60% of their time grazing. Because of this, limited feeding can lead to digestive and behavior problems. So most of us, when we put a horse in a stall, we feed them twice a day and think it's good. Consider breaking down, especially senior horses, breaking their meals up and feeding them more frequently. Not everybody works from home. So it may be as easy as going and throwing another flake of hay right when you get home from work, and then feeding that senior horse again later in the evening, but kind of keep that in mind. When we
So,
talk,
so Jesse, have
Mhm.
you heard of the new track system where they're out continually foraging around?
the new what?
Track system
I have not.
where horses are turned out as returned to being in a herd and
Uh-huh.
are able to walk around 24/7 except in extreme weather.
I didn't know there was a name, but that's exactly what I do with my horses, for a couple of reasons. But we have to take into account everyone's facility. How can they keep those horses
Right.
safe and make sure they're getting enough food? I like turnout as much as possible because those animals are moving and exercising. So with geriatric horses, we need to maintain the level of exercise that they have been doing so that they don't lose muscle mass. They don't. If you put me in an airplane for 8 hours, my knees hurt when I get up. Same thing for a horse. If they don't get to move around, they do become stiff. So I do like that. Overall, 60 to 100% of a horse's diet should be a forage. Do they need grain? Unless they're, working super hard or need to consume a supplement, probably not. But again, it's very individualized. Regardless, a horse needs to eat 1.5 to 2% of their body weight every day. So it's not just they get 2 flakes, especially in an older horse. We need to almost overfeed, and unless they're obese, which I'll talk about a little bit, but think that they're not absorbing what you're giving them as much. So a lot of quarter horses, around 1,000 pounds. So that means that horse is going to need 15 to 20 pounds of food per day. And of that, 12 to 20 pounds should be forage. Now, when we talk about beet pulp, that is going to be considered, a forage. Cubed alfalfa is a forage. So again, this is why it's not easy, and we need to consult people who do it every day to help us, balance the diet for our geriatric horses whenever they're having issues. Just a good reminder, a horse needs to be able to chew their forage to a 1/4 inch before swallowing. If they cannot do that, that's when we really need to look at, do we go to a mash, complete feed, et cetera, which is pretty small if you think about it. A little tip for y'all, if you're in cold environments, I know we had some people in Minnesota, even I know it can get cold in North Carolina and Missouri. When it gets down to about 15 degrees Fahrenheit, it's really a good idea to really increase your hay, because your horse can benefit from hindgut fermentation, so that their hindgut produces a lot of heat. So when it's cold, increase hay. It's something you can do and may be of benefit, in addition to providing, water and or blanketing, depending on age and environment. Speaking of water, water is the most important thing we must provide. Unless an animal is working, clean, drinkable water should be provided at all times. This means don't forget to clean out your automatic waters. I think some of us, I've been guilty of it, I'll be honest. Forget to go clean it out. Yeah, there's water in there, but is it something I want to drink? If not, clean it. Wash your buckets. they do get dirty. And if you use dark color buckets, it's harder to see, or they'll get a little biofilm or slime in there. Generally speaking, a horse will consume between 5 to 20 gallons of water a day. I know my own horses, this varies a little bit. You know, Loopy hates to drink overnight, but he'll drink a lot during the day. But a good rule of thumb is 1/2 to 1 gallon of water per pound of dry matter intake. So if they need to drink, or excuse me, need to eat 20 pounds of dry matter and hay, that horse needs to be drinking between 10 and 20 gallons of water on a daily basis. Then water is super important when it's cold, but also when it's hot. So whenever we just have a, go from 20 degrees to 77 degrees, that water requirement increases by 15 to 20%. And when it's super hot, set out extra water and monitor your horse's water intake. There are flow monitors that work if your horse is on a single automatic water is great, because then it's more difficult to see how much they're drinking. Or look, okay, how much has gone out of a bucket, how much has gone out of a tank. And oddly enough, bucket type can influence water consumption. There are studies out there that show horses prefer different colors. One color bucket isn't the best for each animal. Shape. Now there's some square kind of oblong buckets like this that show that they encourage drinking, but then also position in the stall or paddock. And if an animal is out in the pasture or in turnout, and say maybe you do have a really aggressive horse, boss horse, is the horse lower down on the social pecking order going to have access to water regularly without fear of getting ran off? If not, maybe we consider supplementing with an extra tank. So think through all of those things when we're thinking about water. Also, freeze-proof buckets or heated waters in the winter is super important for the geriatric horse, because water, when it is of itself is cold, while you and I may like it, horses don't. And studies have shown that they actually drink less when the water itself is cold, not just the outside temp. So especially for these old horses, heated bucket, de-icer in the tank, as long as you're taking all the precautions. This, I don't really like this picture for the fact that you can see that cord hanging down behind that blue bucket. If y'all can see that right here. For me, that's a good way for a horse to paw or bite it. There is a coil around it, but be cognizant of that. We don't want to get them electrocuted. All right, next we're going to talk about body condition scoring. So what is body condition scoring? It's really a subjective method that we use to say how fat or thin a horse is. And it's something that's standardized so we can communicate with one another. So if I tell Liz, hey, I have this horse, it's pretty thin, it's a body condition score 3, and she knows how to body score, then she knows exactly what I mean. At different areas on the horse, are there ribs showing? Is there muscle atrophy, etc.? This is based off the one that the AAEP recommends is the Heinke body scoring system. And this is a really high overview. There's a checklist, but overall there are 9 scores that can be assigned. One is poor, super thin. This animal is at risk of death due to starvation. To 9, extremely fat. Their feet may fall off from laminitis because they're so obese. So both ends of the spectrum. Body condition scoring takes time and it's hard to master. So when your vet is out, say, hey, doc, can you assign a body condition score? He or she may say, okay, your horse has a score 5, which is kind of right in the middle. Tell me why it's a 5. Like what would make him a 4 and what do I need to look for? Or a 6 and what do I need to look for? Then keep a record of each horse's score over time. Go back to that record for your physical exam. It's on there, but we're also going to want to do it more frequently. Because I know body condition scoring is hard to do and very subjective from person to person, other things that I like to tell people is take a picture of your horse from the different angles. So from the right side, the left side, just a straight on lateral view like this, from behind and in the front, put a date on it. And then you can pull it up next quarter or next month, depending on their age, and really put a side-by-side comparison to see the difference. because I'm assuming you're seeing your horse every day, and it's hard to pick up little subtle changes over time. Another thing you can do is go buy a weight tape. It's not great, but it's something. And the reason it can be helpful is if you have the same person use the weight tape on a monthly basis, odds are they're going to put it in the same spot, pull it, the same tautness, and really just give you a general idea. Is the horse maintaining their body weight? Are they losing? Are they gaining too much weight? This is a good way to do it when knowing very few of us are going to have access to a scale big enough for a horse. So the next one, I'm going to show you some pictures. There are going to be pictures of body condition scores 1s and 2s, just as a kind of disclaimer. Oh, we've got one more slide. Sorry. So if someone asks, what is the ideal body condition score? I'm going to tell you it depends. Usually between a score of 4 to 6 out of 9 is pretty ideal. But if it's a thoroughbred, they're leaner. Warm bloods are pretty chunky, so they're going to be at a 6. No matter how good a care you take of your horse, their body condition score is going to decrease over time. It's how it is. But monitoring this will allow us to take action sooner than having someone else show up on your farm and be like, oh, that horse is pretty thin. What's wrong with it? Something we don't want. So now we're going to go to the photos. These are not mine. On the second slide, I do have credit to the source where I got this off the internet. I just thought this was a good recommendation or a good view of body score 1, or all the body scores 1 through 9 that we'll go through. So body score condition 1, obviously, absolutely emaciated. Condition 2, still emaciated, but there's a little more muscle. This horse has some muscling in its chest compared to body condition score 1. Body condition score 3, a little more fill over the ribs, through the withers, and then over the hump. Still, this horse is thin. Now, if I walk out there and as a veterinarian and I know this horse is 28 and we're doing everything we need to, that's different in my mind than if I walk up to a neglected horse. So not every horse you see is in crisis just because their body condition score 3. Do we want them to be a 4? Absolutely. But that's something I like to tell people as they're learning. Seeing a body condition score 3 is going to cause me to ask a lot of questions and see how we can improve. Body condition score 4, let's talk about that thoroughbred or a horse. My roping horse, when it's working a lot, maybe a body condition score 4. You can see a few ribs, but overall well muscled. So again, just a different idea. Talk about a body condition score 5. For me, if you're using a lot of quarter horses, this is pretty ideal for them. The ribs are there. They don't stick out. Lots of fill over the rump, through the shoulder and the neck. But then as we start to get a body condition score 6, this is probably my mare that I ride right now. She looks like she's going to foal. Here's a 6. Is this, we're not getting cresting of the neck yet, just carrying a little more body weight, maybe a little fat over the loin back here. When we get to a body condition score 7, these guys are getting pretty chunky. I think all of us would walk up and be like, okay, pretty big belly, don't see any definition over the rump. When you get to an 8, we really start to see the cresting on the neck. You may have some fat pads over the tail head, pretty chunky. Need to reduce the weight of this animal for the health of their feet. Again, there may be a reason this animal is this weight, and we need to ask questions. When you get to body condition score 9, these little guys need to reduce the weight. A lot of pressure on their joints, lots of mental fat, so fat around the organs that can, cause colic, entrapment, etc. Body condition score 9 is serious, not as serious as a 1 or 2 body condition score, but still. So I told you I lifted this off the internet. I got it from theheartoffphoenix.org. I know nothing about them other than I like their pictures. So kudos to them for providing pictures free for use on the internet. So let's talk about, whenever we're looking at body condition score, if we see that that score is decreasing, what are some reasons why? They could have dental issues such as tooth loss and wave mouth. You're probably going to start to notice that they're losing a lot of grain when they eat. And so that could be a reason. Pituitary pars intermedia dysfunction, where, like Loopy here, they have a long coat. They don't tolerate heat and stress or heat and cold very well. This is a medical condition that does need veterinary care. Very common in the senior horse. We didn't have time to talk about it in depth this evening, but something for you to research later and keep in the back of your mind. Internal parasites. Geriatric horses don't tolerate parasites as well. It may be they're losing weight because of pain associated with arthritis or other conditions. They don't want to move around to the feed, or they have diarrhea due to poor water absorption, chronic diseases, or it's just they have less efficient digestion as they age. One thing to kind of think about is that as horses age, also the amount of saliva they produce in their mouth to help soften that food and for them to swallow it actually decreases over time. And that can lead not only to difficulty swallowing, but the enzymes in that saliva helps to break down food as well. Questions on the body condition scoring. I know it's kind of a big, broad topic, but if it's something you can master or at least take those pictures to evaluate on a quarterly basis or on a monthly basis, depending on what's going on with your horse, I think that's a great way to monitor your older horses. All right, we're going to cover a little bit about general care just to make sure we're all on the same page. Biggest thing is have a vet, work with them regularly. That way, when you have a problem, you have someone to go to who knows your horses, knows what's going on, the changes you've made or the medications they're on. So do that on a regular basis. Hoof care. Hoof care in geriatric horses is super important. The soles on their feet get thin. The horses, even though they're not in work, may need shoes. They may need corrective shoeing. If you're in an area with snow and they need shoes because they have thin soles, you really need to have snow, like a snow, I don't want to call it a boot, but like a
Gorium.
Yeah. Thank you. I was struggling there. So think about that, and don't forget hoof care. They're also prone to laminitis. Oftentimes, a horse may be a little ouchy, but not truly lame yet when they first start off with laminitis, and I'll get farriers catch it. So that's another reason for regular foot care. What about bedding? All horses, but especially geriatric horses, need a clean, dry area to rest. If the horses are out on pasture and it's going to storm like crazy or it's been really muddy, pull them in or, change gating so that where they can't get to the areas of mud. But, that leads to, they have to have safe footing, especially in these older horses that, aren't as coordinated as maybe they once were. Ice is important. And then make sure that the area is free of obstacles and steep grades. They have trouble bending their hocks as well. They may have, problems with their eyes, their cataracts, they're not seeing as well. Make it really, really easy. If your horses are in a stall, think about, you sitting on the floor for 20 minutes. You'd really like to sit on a cushion. So let's bed them a little deeper and kind of provide a little bit of padding for the joints. If your horses are turned out, make sure it's a large area with sturdy, really high visibility fence. If you have just a wire or like the rope, the electric rope up, make sure it's wider so that your horses can see it. Put up flags. Again, think about not being able to see as well. Then if you do put a horse into a new environment, do it early in the day. They have time to adequate light, especially if they do have some cataracts, and also some time to adjust so they don't, bolt a lightning in the middle of the night and the horse doesn't know where the edge of the pasture is. Finally, on general care, regular exercise. So keep them moving. If they're used to being ridden, if they're used to regular turnout, do that. Now, don't force it. So if they are having a bad day and don't want to, run across the pasture, fine. And keep track of their pasture mates pushing them around. But a stagnant animal loses muscle mass very quickly. Any questions so far before we kind of wrap up with quality of life assessment? Okay. So this is a difficult topic. It's one that
Can I just ask a question? It's not something you covered, but
okay.
I'm just wondering about is anhidrosis, because my horse, he doesn't sweat a lot
Yes.
when I'm riding him, and it gets very, very hot here.
Yes.
So I know there's some new research and stuff in that. What is your recommendation around this?
First of all, I think keeping them cool and recognizing that. So adjusting the time of day that you're riding, because no matter what you're doing, horses can't control their body temp or are at risk. So, clipping, keeping them under a fan. There are some medicines out there that have been approved recently. Since I'm not licensed in your state, I can't tell you much more than that. So talk to your vet. The good part is there are people out there doing research, and we're making many more strides, and we have more treatment options today than what we had 20 years ago. So for everyone else, that means her horse does not sweat. So that's what anhidrosis is.
Yeah. Okay, thank you.
You're welcome. Conversely, if your horse sweats all the time, that's another conversation with your veterinarian. So if they're just standing there sweating and the younger horse standing next to him is just fine, that says that they're not tolerating heat very well. Great question, Patty. I appreciate that. Any other questions before we move on? All right, so quality of life. Horses, unfortunately, don't live forever. I wish that they would. And so as our geriatric horse, and we've taken all these steps, when do we know that it's time to provide them the gift of humane euthanasia? There are some things we can do, and it's always difficult, and I think people tend to wait too long. So here are some steps you can really do to help you make those decisions and help you communicate with your veterinarian. So keeping records, because even myself, I'm like, oh, that my horse he's having a good day, or he's, not had a bad day in a while, but I don't write it down. So record it. Talk to your veterinarian and get their input. Say, hey, you know what? My horse is 28 or, just not doing as well. I'm not sure how he'll do this winter. Have that conversation, have it early. Because a planned euthanasia is kinder than waiting until the horse is too thin, too weak, can't get up. This also allows us, I'll be really honest, we have to dispose of our horse friends after we give them the gift of humane euthanasia. It allows you to plan for that. And so really a day too early is better than a day too late, but keeping records, and I'll give you some things to look at, helps you make that decision in a very non-biased way. So let's talk about the MED-W or MEDO. I don't know what kind of acronym you want to put to it, but here are the 4 things to look at and kind of check off every day. Movement. Are they getting up and down okay? Can they comfortably walk around without pain? Yes or no? And that's just today. This is not overall. It's as of today. Can my horse get up and down? Are they walking around without pain? Eating. Are they consuming their feed well? Now, if you just changed feeds in the last week and your horse is a little grumpy about eating the mash versus the hay, fine. But if they've been on an appropriate food for a while, how are they eating? Are they drinking? So are they consuming their appropriate amount of water? That 5 to 20 gallons a day. You will know your horse by keeping track of this. So you might say, hey, yesterday they drank well. Today they didn't drink as good. Fine. They have days like we have days. Maybe they were more thirsty that day, but write it down. And then look at their weight. Are they holding their weight on an appropriate diet? Weight, I'm not asking you to do every day. That's the only one I would say do that on a monthly basis. So do it on the 1st or the 15th or whenever you give your dogs their heartworm medicine. That's the day that you say, okay, I'm going to take the pictures, I'm going to body condition score, or I'm going to use that weight tape. And then just keep a calendar and say, hey, check was a good day today for my horse. X was a bad day. And as you start, you'll start to see a trend. It's not uncommon for a horse to have 2 or 3 bad days and then bounce back. Okay. But if you start to notice that the bad days are outweighing the good days, start to think about their quality of life. Questions? I know that's a hard topic, but I'm hoping this kind of gives you some things to really check every day. I am a list person, so I just have these boxes on a daily basis. I just go through and check. Yes. Did I check this? Is it a good day? Is it a bad day? I can tell you from my 20 years of experience, it's a difficult decision. Have it with your veterinarian, have it with the people in your barn so that everyone is on board and understands how you got there. And if you can show them this piece of paper that says, look, I've been evaluating this horse for a while and this is why I do it, that's helpful. If you have someone who you work with regularly, I think someone said they worked with teens and they come out and Precious, the old mare is gone, you can walk through some of those. Any questions on the quality of life assessment?
Jesse, I have a question.
Yeah.
Just, I have a 28-year-old mare who she's got pretty severe arthritis in her front end.
Mm-hmm.
And it's hard, yeah. But the question is movement, I understand all that, but are there signs that tell you that horse is having more pain, like in her eyes and her cheek, and it's just she just looks like she's in pain? Do you know what I mean? Yeah. You guys know
Yes,
what I'm saying, right? So can you talk about that too, like those subtle signs to look for?
Yep. So I believe you 100% when you say you can see it in a horse's eye. And if you see a horse in pain, you could recognize it. To tell you how to identify that is really difficult for me to do that. Horses will grind their teeth when they're in pain. They will shift their weight. They will not eat. They may not lie down for a long period of time. We have to remember horses are prey animals. So for them to show signs of pain is to show weakness. One thing that I really like and is easy to do is go buy a really cheap stethoscope. Amazon has some for $10, $15. Take their heart rate. Know your horse's resting heart rate. In general, depending on the size of the horse, about 36 beats per minute makes me a happy girl. Okay. When we start to get to 50 or 60, I become concerned. And so that's something you can kind of look at. The other thing, if the horse, we know that they have arthritis is the source of pain, how willing are they to walk? So if they love their grain and today they're having trouble walking to their grain, they're probably in more pain today. But that needs to be a self, if they're running to grain because the boss horse is biting their rear, that's not a good assessment, if that makes sense. I think those are some really good things to look for.
Got it. Thank you.
You're welcome. All right. If no other questions, we're going to go through a list of tips. So take a screenshot if you want. This came from AAEP. I didn't make it up, but 10 tips for caring for the older horse. Observe your horse on a regular basis. Watch for the changes and address the problems, even if they seem minor, right away. Feed a high quality diet. Make sure you're avoiding dusty and moldy feeds. If you stick your your face up to that bale of hay and you're like, oh, don't feed it to your horse. And then feed your older horse away from younger, more aggressive horses. So Loopy that you saw gets to go in a little cattle pen, because that's what I have, to eat his grain, and he eats slow and he gets more. And then he gets let back out with the rest of the horses because one of my other mares, she's going to go push him out. So feed him away. from more aggressive ones. Feed more frequently. Talked about, hey, maybe you can stop by the barn on your way home from work, run out over at lunch and feed more frequent intervals if you can. Water is super, super important. Needs to be fresh, clean, not too hot, not too cold. And then monitor water intake in the winter. If your horse likes electrolytes and you've put electrolytes in their water several other times during the day, maybe add a little Kool-Aid for flavor, then when you do that when it's super cold, they're likely to continue to drink. Then adjust their feed to make sure that they maintain body condition. Go back to that body condition scoring or the weight tape or the photos. Number 7, we agree with AAEP, provide adequate, appropriate exercise to maintain the flexibility, mobility, and muscle tone. Groom your horse frequently. I know this sounds crazy, but it promotes circulation, it promotes skin health, and by being all over this horse, you're gonna see the nicks. And because horses don't heal, even if they get a tick bite, maybe they're more reactive now to a tick bite than they were when they were 5 or 12. Then be aware that older horses are prone to tumors. So if you see lumps or bumps, especially on gray horses, check under their tail, check around the vulva of a mare. Do they have something that needs to be addressed by a veterinarian? Finally, schedule routine checkups with your vet and then call if you suspect a problem. Addressing problems early is always less intense and less expensive. So those are kind of the tips. Again, I didn't come up with it. This was provided by AAP, but I really felt it's something, a good reminder for all of us to remember. And you can share with other people who have older horses.
Jesse, I would like to say that how helpful this is as someone who boards other people's horses, and I'm often in a position where I have to advise. And these are some really creative, common sense, practical tips that we could use so it doesn't seem like I'm telling the person what to do. So
Yes.
I greatly appreciate this.
Absolutely. I'm glad. And I'm happy to send you any of these references or the presentation if someone...
I've made lots of notes.
Okay, great. And as you start to research some of this, make sure you know that it's coming from a good source. If you just have a random rescue out there, do I want to take their opinion? I might take their photos, but their opinion, no. Animal health companies, I showed you that one from Merck Animal Health, the records. American Association Equine Practitioners publications do tend to have professionals on with good credentials. So evaluate. And if you ever have questions, ask your vet. If he or she knows that you're working to take care of your horse, they're more likely to make suggestions. So thanks for that, Janice. I appreciate your comments on there. Any other questions? I know we're at time, but I have one more really important topic to cover this evening.
I'm game. Thank you.
Okay. So New World Screwworm. Been in the news. I hope you are hearing about it. It's very serious, especially for those in Texas. This is just be aware, go get more information, talk. I do have all my references on here, but it's a changing daily. So what in the world is New World Screwworm? It is this terrible little fly called Cochleomia omnivorax that affects basically warm-blooded animals, livestock, pets, wildlife, birds. And it's a fly. So it looks about like a common housefly, except it has these really, really bright orange eyes. Now, a scientist would know that that's a Cochleomia omnivorax, the New World Screwworm fly. You and I aren't going to know the difference. But if you do get that close, great. So what do? So they actually lay eggs, kind of like a regular fly, around a wound, except for a regular fly's larva, maggots, will actually only eat dead tissue. So it's gross, but it's not horrific. New World screwworm larvae are horrific. They feed off of living tissue in warm-blooded animals. So if they get in your animal or you have a cut, the New World screwworm fly lays its eggs. The larva will eat the live muscle. Back in 1966, we eradicated this fly from the United States. Unfortunately, we identified it again on June 3rd here in the U.S., despite some really good efforts on the part of livestock producers, veterinarians, the government, etc. Controlling flies is not easy, y'all. So the thing that you need to know is it is a reportable disease. So you're required by law, if you think your animal or you have New World screwworm, the little larvae, contact, and I'll give you a list of contacts at the end, contact your veterinarian, your state animal health official, your doctor, somebody, because the more we know where it is, the more we can do to control it. So like I said, the Cochleomya omnivorax, the New World screwworm fly itself, the larvae only consume living flesh of warm-blooded animals. And the good part about the fly is the females breed only one time, and then they die after their 21-day life cycle. So that allows us to control New World screwworm through releasing sterile male flies. And that's how we actually eradicated it from the U.S. back in the 50s and 60s, was through the use of sterile male flies. So scientifically, we grow these little larvae up and we put them out in the environment. They grow into male adults who can be identified as being a sterile male versus a regular New World screwworm fly scientifically. They breed with the female. She doesn't have any eggs because she only breeds once, and that's how we're going to push it back. So we know that these flies can travel up to 12 miles in warm, humid climates. So if we find a case, the government comes in and sets up a zone around 12 miles around that case. So first one was in a calf had newborn calf, and this New World screwworm got into its umbilical cord, the navel, laid eggs, and then the larva started, a big hole and eating that tissue. And so then the government came in and they set up a perimeter of about 12 miles. None of the animals can move in and out of that perimeter. And then there was, a secondary zone around that. So within both of those zones, now all of the products that the government has approved on an emergency basis, because before last fall, we didn't have any products approved for use against New World screwworm in the U.S. at all. We did other places of the world, but not in the U.S. So we got them moved through quickly. And now those zones will have access to the products that are labeled for use against New World screwworm. So that's super helpful, although you don't want to be in that zone. So let's talk about how long from the time female fly lays her eggs, the eggs hatch, and within 10 to 12 hours, and then you can actually see those larvae within 3 days. So super fast. We can't get it any other way. Our horses and our cattle and the deer and the wildlife can't get it any other way but from having a female New World screwworm fly that land on them and lay eggs. So flies and the larva are the only way you can get it. But as we all know, when we talk about other flies, they lay eggs and then have to go through a cycle. So let's talk about that New World screwworm cycle and what's needed to get from an egg to a larva to a fly and back again. So we'll start up here at the top. So here's my adult female. She mates, and then she lays a fly on open wounds orifice of a host. We should have a horse here. Horses can and will get New World screwworm. Dogs and cats, Boo, I see you have your cat with you. Your cat can, you can. So any warm-blooded animal can be the host. She lays her eggs on the wound. They hatch in about 12 to 24 hours. go through different larval stages. And then if they're not on a wound or orifice, or if a few of them fall off, those larvae then go into the ground and burrow into the soil. They then mature there, and in 6 to 8 days, a new fly pops out. So we does have to go through the soil.
That is terrifying.
It's not good. Because while we can, spray all of our horses, cattle, pigs, whatever, with different fly preventions, the deer, the skunk, all of that do carry it. Also, this means that these larvae can live in the ground, and until the soil gets to around, I think it's 47 to 45 degrees and it's consistent there, they're going to live, and then they'll pop back up. So in the areas where it doesn't get super cold, we do not want this to become endemic. If you get into northern Iowa, if this screwworm were, God forbid, to get into northern Iowa, for example, those larvae are going to die over the winter and then wouldn't hatch the next spring because their soil gets so cold. So, okay, now we're all concerned, which we should be, but let's talk about what to look for in our horses. It can start being very mild. So just irritation, depressed, shaking their head, not eating. Hey, what's going on? If you see a horse just is not quite right, do a thorough body check. We're talking run your hands over every surface, look in their groin, look in the armpits, really evaluate everything. And then, because even the small wound, like a tick bite, can get much bigger and really deep quite quickly if they are infected with New World Screwworm and those larvae are eating live tissue. The animals may have a really bad odor, smell of rotten flesh. The wounds may have like a ruddy, bloody, tinged discharge coming out, or hundreds of little white packets. Think kind of like Tic Tacs and a shingle-like pattern around the edge of the wound. Bottom line, if there's any concern, contact your accredited veterinarian. I'll give you some. You can also contact your state animal health official or your human doctor right away. Just, it's better to ask the question and be like, no, it's fine, they're fine, than it not to be fine. Because not only is it reportable by law, but also we need to treat that animal right away to get rid of the larva and stop the damage they're doing. They may or may not need secondary bacterial antibiotics, other treatments. This can become life-threatening very, very quickly. So who's at risk? Basically, any animal, I'm going to say, or human with a wound is at the highest risk of New World Screwworm infection. It's attracted to the smell and the scent of secretions from a wound. And like I said, it doesn't have to be a big cut. It can be small, it can be a tick bite. Castration. So, if maybe you've got a stud colt right now that you're, thinking about castrating, let's talk about time of year to do that. I know in Texas, the ranchers down there were trying to move the calving season so that calves weren't born during fly season. That's a hard thing to do, but even an umbilicus, the vulva of an cow or a horse that has recently foaled or calved, is also an attraction. They're also attracted, these silly little New World Screwworm flies are also attracted to mucous membranes. So eyes, nose, mouth, genitalia. It's not just really a wound. So be cognizant of your animals and look at them daily.
Good Lord.
Yeah. So what can we do? Isolate and inspect all new animals upon arrival. An inspection now went from, yeah, you look pretty good, to I want to look, under your jaw. I want to, like I said, armpits, groin, under your tail, everywhere very closely whenever animals come. So we can see, are there wounds there? And if there are, we're going to try to treat and cover those wounds pretty quickly. Apply insecticides to animals with wounds and prior to standpoint or prior to transport There is a guide on the AAEP and the FDA websites for what to use. And if you're in a region where a new world screwworm is present, again, coming back to try to delay any husbandry practices that could cause wounds. This is even clipping. So unless you really have to clip a horse, we've all clipped and accidentally got too close at some point, don't even do that until fly season ends or control measures are put in place. Also, check and remove animal or any sharp objects. I know if your horses are like mine, they can get hurt on air. Do your best. Go through, look again. And then one thing that's not on here, but I think is pretty important, control areas where flies attract. Pick up your manure, cover your manure pile, take all the preventions that you normally should be doing and elevate it a step. Manage tick levels if possible. This is hard, but I would say on yourself, it's more important now than ever, wear a tick deterrent. Put that on your dogs. And the really only other overarching thing that can be done and is being done by the USDA is to release the sterile male flies, and they're doing that regularly. And we're increasing production of those. I'm sure you've heard about that on the news, but this is why it's so important. I will say to date, knock on wood, there's not been a case reported to my knowledge in horses. It has been in a dog and cattle. And then we've seen some deer on a camera and at a hunter's camera that looks like it could have had an infection in Texas and New Mexico. So what happens if your animal does get New World Screwworm larvae? There are products available that are approved for emergency use. And it has to be used under, the FDA will say who can use them based in those zones. And it has to be under a valid veterinary client-patient relationship. So this is why, again, you need to have your vet. And some of the current challenging things for us is there's not a lot of studies in New World Screwworm in horses to say what's effective. When we look at our livestock, there are lots of studies out there showing what is effective against New World Screwworm in cattle, pigs, dogs, and cats even. Just not a lot in horses. So that is a problem. There are 4 products that are approved as of today. This can change at any time, that are approved. But again, the FDA has control of these products. They will bring them to you, say, please use this if you ever need to. Just know there are some things out there. But let's hope we can get it under control, and we just know more about New World Screwworm than we did a month ago. My big call out is New World Screwworm is zoonotic. That means it can go from an animal to humans. So if you think your animal has New World Screwworm, after you call your veterinarian, make sure you are checking yourself for wounds. That they're thoroughly cleaned and covered and monitored by a human professional as well. So now that we're all frightened, we know kind of what to do and how to control flies. Let's talk about traveling with horses, right? Horses come and go frequently. Livestock come and go. Dogs and cats come and go. States and even countries are changing their travel requirements on a daily basis. So what I thought I needed to go from Missouri to Texas and from Texas back into Missouri 2 weeks ago was no longer valid. So always get a health certificate. And I'm now recommending, especially in places that in the South along the border, that you get a health certificate, even if you're traveling within your state. And so your veterinarian will know, hey, what are the new travel requirements? I know right now, interestingly enough, this came up through Mexico from Latin America, and now Mexico closed the border to livestock, horses, and they had dogs on there for half a day coming from the U.S. into Mexico because of New World Screwworm. They want to make sure that it isn't brought into Mexico from the U.S. So who knows? It's going to change, and it's going to change rapidly. So just try to work with your vet if you're going to be traveling with your horses. We talked about New World Screwworm being a reportable disease. So what do? Texas has been preparing for this for a very long time. I know the Texas state vet. He is absolutely amazing. They have the Texas Animal Health Commission. You can report directly a suspected case directly to the Texas Animal Health Commission or to the state veterinarian, or call your accredited veterinarian. Another option is to find the APHIS area veterinarian in charge of your state. That's what you would do if you were here in Missouri. But call someone and get their attention. Don't just talk to the receptionist. Make sure you talk to somebody. If not, keep calling down the list. Wildlife. So the person who saw the deer on the game camera that looked like it had an injury and that could look like New World Screwworm, call Texas Park and Wildlife, or you can call the USDA Wildlife Service office. If you call your vet, they're going to know what to do. So just call your vet. Same for pets. If you suspect it, hey, there's this wound on my dog that doesn't look quite right, call your veterinarian. Humans, don't call your vet, call your human doctor. You may have to jump up and down a little bit to get a human doctor's attention. I don't think the human side is paying as much attention to this, but don't let it go, because a few hours can be impactful based on the damage these larvae can do to muscle and other tissue. So, questions other than, so what should you do? Stay informed. New World Screwworm reported cases and locations are changing daily. Be vigilant. Check for wounds. You're already thinking you have a geriatric horse, so while you're looking at them, look at everybody on site. Practice good fly control. Don't forget to pick up your manure. And then if you suspect a wound doesn't look quite right, just call your veterinarian. Questions for me on this? I appreciate everybody staying a little longer.
Yes, because this is so fantastic. Both parts of this. I've done horses my whole life and I learned a lot.
Well, thank you.
So I agree with Janice with the thumbs up. Thank you. That was so much information, so concisely done.
Yep.
No wonder everybody wants you. This poor woman's on the road all the time. Now I see why.
Yeah, well, thanks. You had a question, Liz, about horses leaving Texas. So I have not looked since last week, but as of last week, many states are putting things in place that. So normally when a horse travels, let's say to Florida, there's a lot of horses that go to Florida for competitions. The veterinarian that's writing the health certificate will call and get an import permit number from the state of Florida. When you get that import permit number, you have to say, this horse has been in Texas for the last 30 days. Now, maybe Florida's not a good example because I don't really know, but now whatever state you're going to is going to have other requirements. So where in Texas? North Texas, you may be okay. Southern Texas, they're going to have to be inspected. Make sure they're not in a zone, a stop movement zone or a secondary outer zone. They will have to have specific fly sprays applied and likely be inspected by an accredited veterinarian for the any wounds. So it's going to be rough. We think of all the competitions that go on. And I think we're going to see some impact. I don't know what all that's going to look like as of yet, but that's why I'm saying if you're going anywhere, get a health certificate, be cognizant of flies and do what you can do.
Question. I know we're over, but you say be cognizant of flies. What about fly spray, general fly spray that works? Like, is there recommendations in that on those?
There are no recommendations on fly sprays. That gets a little iffy based on how they're registered. They don't have to necessarily go through specific efficacy trials. So anything, the products approved by the FDA had to be proved to be efficacious in a setting, in a scientific setting, where you could say an animal given this that was then exposed in a research setting to the New World Screwworm, either this New World Screwworm larva died or they didn't, the fly or the eggs didn't hatch. Like, it's really scientifically driven. On fly sprays, I can make one up and sell it to you tomorrow. So I can't make any recommendations on that. Sorry, I wish I could, because if someone had a fly spray that was, you know, proven to be effective against New World Screwworm, they would sell the heck out of it.
Yeah.
So I'm thinking, like, one of the things, fly masks for me is something I would probably revert to and make sure that they fit well so flies can't get in, just because they like the secretions. I'm going to be super adamant about, like, I took a picture and I didn't find a way to put it into the presentation. I had a mare who just kind of had an abrasion. It was not deep. I, you know, typically would have just taken an appropriate salve and put on there and put the salve on and washed it for a few days. If I was in a New World Screwworm area, I probably would have wrapped that and made sure I wrapped it in a way that it was sealed.
Right.
I don't know if that helps you at all, Patty.
Yeah, well, just looking even just in general, keeping the flies off, because I guess be the first step, right?
Right. But I mean, for me, am I going to put a fly sheet on a horse? I don't know that that's going to, if they don't have a wound, these eggs aren't going to be laid. And I can't, you know, I can't cover all of them, but.
Right. Yeah. Okay. Thank you.
Welcome.
This was great.
Well, thank you. Thank you. Thank you.
You're welcome. Sorry for keeping everybody longer. I did give a warning. But I have one last thing. If you want to join the welfare committee, we will have a meeting Monday, July 6th at 6 p.m. Central. It'll be over Zoom. Send me your name to my email address listed here, or send it to Nicole. She can send that out. And Nicole, I apologize, I spelled your name wrong. I met with a different Nicole earlier in the day, and that's how she spelled it. So that's what I put on there. But we would love to have input as the welfare committee gets up and going. We had a meeting of the minds a couple of weeks ago. We want to really start to dig in and say, how do we make sure a horse is ready to work from an emotional level? There's some really great research out there, but want to get input on what you guys feel is impactful for your organization. And it's a great way to get involved as we move forward and kind of build out a few guidelines in the next few months to a year. So
that's great.
Love to have you.
Well, thank you. On behalf of all of us and the horses, thank you too.
Absolutely. Have a great evening, y'all.
Thank you.
Thanks, Jesse.
Everybody.
Bye, guys.
Thanks, everyone.
Good night.